Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Today, we are in celebration mode because it is Patient Experience Week. And I get to celebrate Patient Experience Week with one of my favorite patient experience professionals today, Nicole Cable. Thank you so much for being with me today. It is so good to talk to you.
Thank you so much. I'm happy to be here.
Well, so I feel like I could introduce you, but I want to make sure we get all your bona fides in. So can you give us a little rundown on who you are, what you do, and how you got involved in this whole patient experience movement thing that we're a part of?
So, I am Nicole Cable. I am a certified patient experience professional. I hold a master's in health sciences, and I am fanatical about process improvement. So, I have a lean black belt as well. I've been a chief experience officer for the last 5 years. I started my own company, consulting for healthcare organizations in the healthcare plan space, as well as physician practice groups, and currently working with a really cool company called Lifestyle Medical, who focuses on the entire journey of their members, and making sure that they have optimal health. So super excited to be involved with that, and just really passionate about experience. I've been a member of the Barrel Institute for God, I don't even know how many years now. I sit on the strategic board as well as the patient experience policy forum board. So very active in that work, also active as a patient in the patient safety movement. So I live this and breathe this, and I am currently in school pursuing my PhD in public policy.
Excellent. I didn't know you were doing doctoral work, so that's fantastic.
Yes.
Congratulations on that.
Thank you. It's a rough journey, but I'm trying.
I am not jealous of you and the academic pursuits at the moment. So,
No,
but
neither am I
congrats.
right now. I'm thinking like, why did I even agree to do this? But it was just something personal for myself. It wasn't anything where, I needed to have it. I sort of told my mom before she passed away that I was going to become a doctor, and she was like super encouraging. So I'm just trying to fulfill that promise.
That's beautiful. That's beautiful. So, but you're not a clinician, right?
No, 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 no. I'm a
No,
patient.
same with me in the same realm. I'm not a clinician, but I feel like even those of us who are not clinicians have so much to add to this space.
You know what? I believe so. I heard a wise woman say, we hold PhDs. Patients has disease. So technically, we do have PhDs, as
Yeah.
patients.
Yeah.
So, um, and that's interesting because when I got into this work, I mean, I'm hospitality by trade. I came from Marriott. And before that, I was in retail. So I've been in three industries in my career, in my lifetime. And so I was recruited into healthcare because I worked for a Marriott. And going into academic was a bit of a struggle because I am non-clinician, and yet I'm being tasked with telling doctors how to deliver better services and staff. So um, it was challenging, but I learned a lot of how to do that, how to have those conversations, how to speak to them on their playing field, so that they understood the importance of what we needed as patients when they were treating us. And I actually acquired a hospital infection when I was working at Marriott. So I went through a whole process where I had no desire to work in healthcare. Like that was the furthest thing from my mind, after all of my inpatient stays and drama that I had as a patient.
I'm sorry to hear that. And I've also been the not so proud recipient of a hospital borne infection that
Mm,
nearly took my life. And
yes.
so I empathize with you on that too. Um, but I assume that some of that had to drive what what you're doing today, right?
It did. It did, kicking and screaming. Because when I first was brought into the conversation of coming in from hospitality to healthcare, the gentleman that I met, which would become my boss at one point, was just really trying to transform the way we delivered care at the hospital. And while I was a little apprehensive about it, I prayed about it, and I consulted with the folks at Marriott, because they really were my family when I was going through my my healthcare crisis, because I had moved to Maryland um, about a year before, and I didn't have family or really friends in that state. So as I started really suffering with healthcare, my Marriott family or colleagues became my family. In fact, the head of HR said, "We are your family." And so they would be there with my surgeries. They would come to my house. They'd bring me food. So I was really vested with them as an organization because they really took care of me as a person. So it was a hard thing to do to leave them just because of that type of relationship that I had with them. But when Johnny proposed what he wanted to do at University of Maryland, I jumped in with both feet, and it really did help me because there are things that I had to deal with as a patient that the clinicians and staff didn't really think about, like words like frequent flyer, right? You know, that's like automatic bias, right? So in your mind, when you say those words, you're probably not going to treat me the way you would treat someone presenting for the first time. Yet, when I was a patient, that happened to me where a physician literally told me I was drug seeking, and I must have been my, I don't know, like seventh or eighth time showing up at the ED. And every time I showed up, I was always admitted. And so I knew that there was something wrong. And he just said, "Well, you know, you people, you know, you always looking for drugs." And I was like, "Well, who are we people?" Because I'm trying to see, is it my skin color? Is it because I'm female? Like, what is that? So he sent me on my way. And thank God I had Kaiser Permanente. I went to urgent care. They did a simple x-ray and discovered I had a bowel obstruction. So I had to drive back
Ugh.
to the hospital and let them know that yes, I have a bowel obstruction. And thank God, one of the attendings who I knew, because I'd been in the hospital, I'd been seeing their pain management doctors. I mean, everything I did was at that hospital. I would drive 3 counties over just so I could go to that hospital because I knew everybody there. All my care was there. And so this one incident just really kind of honed in on me the power of words, how it made me feel when he said that to me, and he wouldn't listen. He wouldn't even listen to the nurse who knew me, because again, I'd been presenting, but sharing those stories in the hospital really, I think, hit home for some of our clinicians and ancillary staff. So they knew that I wasn't there to say you're doing a bad job. My position was, here's what the perception of the patients have of us as a facility. Here's what they believe we're doing. If we're not doing this, then just work on changing the perception so they understand the care that we're delivering. And that's been very successful for me with getting them to understand why we need to be more compassionate and have more courage in listening to the patient, and know that it's not a diss on your professionalism. It's just you have to come to a happy medium, and the patient has to feel like they can trust you in order for them to adhere to a care plan. And that's always been a challenge, I think, in healthcare.
And how hard is it to hear, as you stated, through our biases and through our distractions that are on the working schedule every day? Wow, and you have so much empathy for having a bowel obstruction too. I have been had one of those, and I often say that that's as bad as crushing every bone in my face. Yeah, bowel obstructions are horribly painful. But
They
what a
are.
testimony to that facility that you would drive 3 counties over. That's that's showing something about great patient experience.
It was. I had Kaiser, and my doctors, my surgeons actually had, uh, they practiced there. They were able to do surgeries there. So I had struggled finding good people at KP, to be honest, Kaiser. And I finally found my doctors that I felt like these are my physicians. And so I was very loyal to those physicians. And so because they could practice out of that hospital, um, I did all my surgeries there. I mean, I lived in Baltimore County. That was in Montgomery County. So I'm traveling a distance to get there, and in a lot of pain, usually a 10. So by the grace of God, I made it there, made it there. And then being on the inpatient unit, the nurses on those units were really like family. There were times where I didn't have one, they still had those visit restrictions, which was ridiculous. So my friends who got off from work at 6 o'clock and by the time they got there, could only be there for 30 minutes or maybe an hour at most. And so I was there and my longest stay was over 31 days, and my average stay was about 14. And I had 13 of those admissions. So there was a lot of loneliness and isolation, even in the hospital. And so the nurses became my companions. They would come and sit in the room with me, talk to me, check on me, get me up to walk. And sometimes they would even take their breaks in the room with me, so I wouldn't be by myself. So it was very empowering and just very satisfying to know that they cared about me and they were that invested in me as a person, and in my health. And the nurse manager, I can't say enough about her. She was phenomenal. She would try to get me in my own room. So they would hold me in the ED until they could get me a room that would be a private room and then bring
Hmm.
me up. So they just were phenomenal. And my doctors, for the most part, were amazing there as well. My pain management doctors were completely empathetic to me and just really trying different medications to try to address the issues that I had. But eventually I had to have a pick line, and I had to go without food for about 3 months, and I had to go without uh, water at one point for almost 3 weeks. I had to have fluids through IVs and ice chips on my lips so my lips wouldn't crack, but I couldn't drink or eat anything for a long periods of time because I had major surgery, 3 major surgeries in that area, and the only way that they could resolve my fistula was to prevent me from eating. So that was a struggle because
Wow.
every commercial you would see was food. I still remember the ragu commercial of the woman dipping his bread in the sauce, and I just looked at it and I was just salivate over watching him dip that in there and missing how food tastes and wanting to eat. And it was a lot of stress and drama, and I didn't think I could get through it, to be honest. At some points I just wish, like, okay, God, if this is it, just take me now, just go and let me be done. But by
Well,
his
how
grace
did
and
you get through it?
a lot of prayer, a lot of
Yeah.
faith, because I grew up in the church, and just having the people around me, the compassionate people they put in my space. I remember when I was feeling very, like, I think I should just die, right? And this nurse I had, and I didn't know she was battling cancer. She had said to me, Nicole, you gotta, pep up. It's gonna be okay. This will pass. And I'm like, yeah, but when? Because every time I come in here, you don't know what's wrong with me. You can't figure it out. You don't know what the next step is. You're telling me I gotta have another colon resection. This time it's gonna be in a transverse versus a sigmoid. You can't guarantee that I'm not gonna have a permanent ostomy. I already have an ostomy. Like, what's going to happen? I'm not going to be able to have children. I got to have a hysterectomy. So it was just one thing after another. And she just said, you know what? And it's just hilarious because, as a Black female, um, and a Black woman, as my nurse was, she literally took her wig off and was like, I've been battling cancer for 2 months, and I'm going to make it through this. And so will you. And that was like, okay, things just got real with her taking her hair off. So I was like, okay, I have received your words. I feel what you're saying and I believe it. So that woman, and that little act of kindness, um, really kind of transformed the way I thought about what was going to happen to me in the future. And so, again, that comes to words, right? It's the power of words. Our words create worlds. And so when we speak positivity over someone's life, it really can transform how someone sees what's going to happen to them. So, I really believe in words. And I think we can either speak negativity or we can speak positivity. And after my struggle, I just choose to always go in and speak positive. When I would go see patients that were sitting in the ICU who were in comas, I'd walk in that room like, hello, Mrs. Smith. It's so good to see you. I can't wait to meet you. And,
Mhm.
I was always positive because I always felt that they could probably hear me, and I choose to be positive. I never spoke anything negative to any patient going into a room or encounter because I just didn't know what if my words were the catalyst for them to keep going, or if they just needed to hear something positive.
You talk there. There were a couple of things that came up. First of all, it sounds in narrative medicine, and I guess also in the work that I do at Notre Dame, we use the term accompany, right?
Mm,
That someone is accompanying you on your struggles or your journeys, and it sounds like you had that from this very special nurse, but you also had advocacy. You had somebody to advocate for you to be able to get that private room, and for you maybe not to have to spend hours upon hours in the ED. And what obviously those two things make a great help to form a great patient experience. What
mhm.
are what are the other key elements that you try to get across to, whether it's clinicians who are dealing with patients? What are the other things that you try to instill out there?
Definitely around plain language. That's huge for me. Understanding uh, for patients to understand exactly what's going on. Definitely including a care partner. So if the patient has a friend or a family member, making sure they're a part of that. Um, Empathy, huge for us in healthcare, no matter where you sit. And I think, we always talk about we're humans serving humans. I think remembering at the end of at this encounter, that you're a human being serving another human being, and not a disease, not a condition, not just a patient, but a human with feelings, emotions, and fears. And that you have to take that into account when you're sitting there and giving bad news. I mean, I've been told um, when I first started being ill and I had to have a hysterectomy, eventually, I had to have one eventually. I was 27 when I was
Mm.
told, and was waiting to get married to have children. And I had wanted like 10 kids, like I wanted an African tribe. I wanted like a lot of kids. And I was going to adopt some and have most. And so I just wanted to wait until I got married. So being told that I had this tumor and they didn't know what it was. And then after some tests and being rushed to the hospital via ambulance and not knowing what's going on, emergency surgery, this doctor came in and just said to me, hey, like literally he said, yeah, so you have endometriosis, which is like stage 4. Your fallopian tubes and everything are completely jacked up. Like that was his term. Didn't say, just jacked up is what he said to me, which I was like, what in the world is
Jacked
jacked
up.
up? Is that a like medical term? And then he said, oh, and by the way, you will probably never have children. So, you'll never have kids. You're just so messed up there. So you have any questions for me? Okay, well, you know what? We're going to discharge you probably at the end of the day, and then you'll see your doctor when you're done. Okay, have a nice day, and walked out the room. And I was still sitting at the process where he said, you won't have kids. But I didn't even know what endometriosis was. Like, what in the world's endo? Like, I don't even know what that is. So it was, advocating for myself, like trying to find a support group, like, what is this? What does this mean? And finding this one group in Maryland that had maybe 10 members in it, and a woman named Glenda Mott, who wrote the book Coping with Endometriosis, which actually spoke to her, which was a nurse. That was like the scope of what I could get out of endometriosis and what that meant for me. And that just started a whole journey with you having to advocate and do your own research, because there really wasn't people out there at that time that knew anything about it. And mine was so advanced that it actually wasn't on the bowel wall, it went through the bowel wall. So that was even something in itself that I couldn't find in literature at that time, around like, how do you treat this? And I remember reading, and when I had to go get like barium enemas and tests done, the doctor was like telling me something, and I was like, but the studies say that's inconclusive and that really doesn't support that, what she was saying. And she was like, you've been reading? I said, yeah, because I wasn't internet searching. I was reading your journals to see what was going on with it. So um, she was like, yeah, you're right. We're going to have to do this additional test. I'm like, I thought so. And then that kind of started the journey for a lot of diseases, like a lot of things that I was battling all at the same time. And this is someone who was relatively healthy, who never really had any bad trouble with her body ever, with my body. until I started having those situations occur. And then at that point, it was just, one thing after another, after another, after another. And then the infection in the hospital was almost ended my life. It wasn't even the diseases that I had acquired. It was that. That was the ultimate.
You've been through it. You've been
Yeah.
through it. And one of the questions that I always ask guests, and maybe you've already told this story, but I always ask guests to really reflect on that idea of someone being there for you or you being there for someone else, giving them your presence, much like Jennifer gave me in the emergency department. And with my pre-meds every semester, they write a paper on a time that somebody was there for them or that they were there for somebody else. Is there a story that comes to mind other than your nurse manager who sat down with you and advocated for you and accompanied you? Is there another story that comes to mind about somebody that was there for you? Or vice versa, if you were there for somebody else in a completely different way?
I would say my mother. So my
Mm.
mom actually was, she died in 2020. And
Mm.
when I,
Sorry.
oh, thank you. So, and her death actually was this Tuesday. That was her death anniversary, was this past Tuesday.
Oh,
So
those are
this week
difficult
has,
days to get through.
it is, and this week has been pretty rough. But with her, it was taking what I knew and learned in healthcare by God's grace and applying it for her to be her advocate when she was in the hospital. And, she didn't like being in the hospital. She was always a person, it was the last, like she had to be drugged and dragged to the hospital for something. And just when she got there, it was, I had great employers, so I could just take off and fly to Louisiana and be there and be present for her and to be able to answer those questions. So when they were speaking in medical jargon, being able to understand what they were saying, because I had been an academic, I learned a lot from the providers there. And even in my studies, I learned a lot around AP, analogy, the analogies that we use in healthcare, anatomy, physiology, all those different things. So it allowed me to be able to interpret what they were saying and then even advocate for them to start speaking in plain language. And I didn't have a problem asking someone to wash their hands. I didn't have a problem saying, let me see you wash your hands. So those things that, we as patients would be a little like reticent to say because we're fear of retribution or just causing, drama. I didn't have those fears because I had learned that these are the things you advocate for as a healthcare professional, as a healthcare patient, a patient in healthcare, and then teaching my sister to do the same thing when I wasn't present and I had to go back to work. So um, being there for my mom was, kind of like a full circle moment. And then um, when she was actively dying at home, having a caregiver that was there for my sister because I wasn't able to be there when she finally passed, knowing that she had a really good hospice nurse that was with her to care for her as she was taking her last breath with my sister, sort of gave me peace. But we had to find that nurse because we had others that were not that great. So I think
Mm.
just having the ability to find the right people that had the right compassion or had compassion, period, was very key and instrumental with us being able to say goodbye to her with some grace and dignity.
Yeah, I'm sorry about your mom, but I'm
Thank
glad
you.
that it was a peaceful exit to this world.
Hmm.
So your mom sounds like a very important person in your life. Is
Yes.
she one of the first ones who taught you like what true leadership is?
Yes. So my mom and my uncle were very instrumental in my growing up. I grew up in Baton Rouge, Louisiana, so I'm a country girl by birth. And mom just never put the fear. She's always like, fear is, you should never be fearful of anything. And whatever you decide you can accomplish, you can accomplish. And so she really kind of put that in me. And I remember, I think I must have been like 19 or something. I was going to LSU for a while, and then I wound up leaving college and was offered this great opportunity to move to Pennsylvania, which I'd never left the state of Louisiana. I'd been there my whole life. And I remember packing everything I owned and getting on a Greyhound bus with literally $5 in my pocket and heading up to PA thinking that this is going to be it for me. I'm going to, I'm going to be something like a Dolly Parton movie, straight talk, whatever. I'm going to be up there. I'm going to make it big in Pennsylvania somewhere. I don't know how I'm going to do it, what I'm going to do. I think I was there for like 2 months and I wound up coming back home for a little bit. And then I was like, no, I'm going back. I'm going to, my mom's like, yeah, go back. You can do this. And it was so hilarious. I went back and, I had some friends there at that time I'd made, and I wound up getting this temp job at a mail order pharmacy, which I guess that was my first healthcare job. Never thought about it that way. And then I ended up with a company called Circuit City Stores Incorporated. And that was the beginning of everything. And I never looked back. And I have, I've not lived in the state of Louisiana much since I moved away, and had a really good career and got into healthcare. So yeah, mom was always the one saying, you can do this. Don't be afraid, just push forward. And so, I thank her a lot, even now, with everything that I've accomplished, and I'm still learning and growing as a professional. I give all the, the grace and glory to her for that. So mommy is it.
I always love to ask that question of people that I know are in great leadership positions. It's like, who taught you? And I feel like it kind of takes the person off guard sometimes, because they go back to the immediates in their profession. Like, this is a really great first boss or second boss, when really we learn leadership in the home. We
Yes,
learn leadership in the home from a very young age. And it
we
sounds
do.
like you had a great example.
Oh yeah. I mean, yeah, it's easy to fall back on a leader, but you have to have something. I mean, you have some sort of foundation, right, to build on to determine if that leader is really a great leader, right? So I think we learn it early on in our with our families, and then we start to see what true leadership looks like when we get into the workplace, and how that particular leadership applies to our work every single day.
What's something exciting that's going on in your work or in the patient experience movement right now that's intriguing you or exciting you?
So I am actually in love with blue zones. I am now like this Kool-Aid drinking person now for blue zones. I think that it is going to be revolutionary. I've been overdosing on the Netflix special, and I'm actually signing up for the course that they have at Arizona State about blue zones and learning more about it. And, coming from physician practice group, I should work at Chin Medical. That's how I ended up in Florida. I relocated down for Chin Med. I was their first patient experience employee ever, and really loved the model that they had in place for taking care of our seniors, because we were a full risk capitated model. And so a lot of our work really, really focused on engaging our patients and their family members in their care journey, and making sure that we were able to manage all their complex conditions. And so it reminds me a little bit of that, but takes it to just a whole nother level. But just seeing how you can influence patients' behaviors by actually getting them to trust you first, right? And so, and then giving them an outlet. So addressing loneliness and isolation, um, giving them a space to do Tai Chi and Zumba and silver sneakers and all those different things, and two-step dancing. In certain markets we had in Chicago, South Side Chicago, they wanted two-step, which I had never heard of before, because I thought like two-step was more of a country western. No, this was
Hmm.
not country western by any stretch of the imagination. It was something way different. But I would get out there and dance with the scene. I'd get out there and dance with our patients. And then there would be other things where dominoes was, key in certain parts of South Florida. So just understanding what spoke to them socially and the different demographics was something that was very powerful for me. So I think just kind of continuing that value-based care, focusing on the whole person, that really excites me. And then I think it helps to really drive cost, right? Because healthcare is ridiculously expensive. So if you can create these models where where patients feel like they're really being valued and listened to, it really helps. And then being around patients, like my oldest patient that I've ever worked with, was one. She turned 107 last year.
Oh my
She'll be
goodness. Wow.
108 this year, and she's still here. Her daughter was 87, and she doesn't. She walks with a walker, but she walks, and she will tell you whatever she feels like telling you, and she is just as sharp as a tack. And
Mm.
so, we always, since I've been in this space, we've always celebrated Centenarian Day, which is September 22nd. And it's always a pleasure to just sit and listen to them and hear their stories and realize what they have seen, turning 100 or 102, 103, 104, 105. And you're just like in awe and what they did to get there. It's
Mhm.
just next level. So I love this work. I think that this is something that's really something healthcare needs to really focus on. And it'd be nice to see it happen across healthcare plan, physician practice group, hospital, healthcare systems, the whole ecosystem coming together around whole person care.
And that's why we need people like you.
Thank you.
That's why we need people like you. Hey, are you in your home office today? Or are you in business office, or where are you today?
I am in home office and I didn't know how to blur my background. So you are looking at my Miss Pac-Man machine. I am an 80s girl. I will
I was
own
just
it.
going to ask you, what is the coolest thing in your office? And to hear you have a Miss Pac-Man machine in your office is super cool.
I have wanted that thing since I used to go to the arcades as a kid and wait my turn to get on the machine. And Miss Pac-Man was my favorite. And I was like, the moment I could afford to buy one, I'm buying one. And when I made cheap, I think it was at NovaCare Health, and I saw
Uh,
one go on sale. I was like, I'm buying this thing and I'm putting it in my office. And I don't play it as much as I thought I would play it, but it's there
yeah.
when I have the mood to go and play Miss Pac-Man.
And it's a great conversation piece.
It is. I always blur it out though because I'm like, who wants to see Miss Pac-Man in the background? But I couldn't do it today.
Nice. What's on your reading list right now?
So my reading list, I gotta have to tell the truth. I am a huge history buff.
Mhm.
So I am actually reading The Plantagenets by Dan Smith, Dan Jones. He is actually a historian out of the UK. And
Okay.
so my reading list is all about, the Plantagenets and just because I live in healthcare, so I need something that I actually like something else I love, which is history, particularly European history and how it impacts American history, obviously. And so he is one of my favorite authors. So that's who I've been listening to for a while, or reading for a while.
Nice, nice. I love it whenever there's something on the reading list that's not just professional. So, all right. So, Nicole, I can't thank you enough for being with me and for being part of this patient experience celebration episode. Thank you for doing what you do in patient experience, and always thank you for having the best hugs at any conference that I go
Oh, thank you.
to. And so, I guess my last question for you today then is, if you had the world's largest mountain and the world's largest billboard, what's the message that you would want to share with humanity?
Oh, that's not a hard one. It would be words create worlds. Words create worlds. Speak well. To shorten Cherokee Billy's quote, words do impact humans, so speak well. That is what I would say.
It's beautiful. Any other things you want to share or promote? Anything you got going on?
Uh, yeah,
Want to share
just
anything about your consulting work?
oh, you're so kind. So I
Sure.
started this group called Ignite HX. So because I believe fire of human experience. So when I first started as a CXO in the Medicare Advantage insurance world, I was tasked with the experiences for employees, employees, providers, and also our members and patients. And so um, I came up with, OHX, the Office of Human Experience, which really wasn't no one really was using that terminology. Now it's all over the place. You can't get out of HX. And I really love that about it's not just, patients or providers or team members, it's everybody, right? We're humans for humans. So I started HX just so I could start influencing that perspective. And so I had friends come to me and ask me to like help them with stuff, and I would do it for free. I was like, oh yeah, sure, I'll help you out with, and I'd give them my strategies, I'd give them all my stuff. And then I started seeing my friends become CXOs, and I'm like one just became one, and I was like, I might have something here, so let me try to use this as part of a business plan. And one of my good friends, Ben Quirk, just kept pushing me like, start your own business, start your own business, start your own business. I want to be your first customer, start your own business. And I kept saying like, Ben, I don't even know the first thing about that. And so through his mentorship and God grace, he kind of pushed me to launch it. And so I've been doing that off and on for a while now. And now I'm working with Lifestyle Medical with their whole experience service excellence program and bringing that to birth, and then the Blue Zone initiative that they're creating. So I feel very blessed to be able to do that. I do miss being in the hospital, seeing patients every day. But through this work, at least I'll be in the clinic seeing patients and interacting with them as we build their programs in co-design with their patients, with their members. So it won't be anything that I'm doing. It will be me co-designing it with their patients and their staff. So it'll be their program, not a program that I just, pulled out of a box. I wanted to make sure it's very personalized for those stakeholders. So that's about it right now. Working on that.
Well, no matter where you are, you're doing good work. And I
Oh, thank
appreciate
you.
you, and the patient experience world and the human experience world appreciates all your efforts too. And um, thank you. Thank you.
Well, let me thank you. I remember when I first met you at Barrel Conference, and I said in your presentation, and it was fantastic. You really, 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 I couldn't get your books fast enough. The work you're doing around compassion and courage in healthcare is everything. You were instrumental in me even talking about my healthcare journey because I never talk about it, and I definitely don't do details. I'm very high level. If I have to tell something, I tell very little stuff. And your vulnerability of telling everything that happened to you and how it transformed your life and how you took that and moved to transform healthcare as a whole means a lot to me, not only as a healthcare professional, but also as a patient. So I thank you for what you do for us every day and getting these stories out so that we can make healthcare more equitable and more fair for everyone that is seeking care. So thank you.
Yeah. All trying to work towards a better world. That's
Yes.
what we're all trying to do. All right. Well, thank you, Nicole Cable, for being with me. And thank you, listeners, for being part of this patient experience celebration episode of Compassion and Courage. And again, this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Please, if you have any comments or questions, feel free to drop those in the episode, and we look forward and thank you all so much for sharing and rating and reviewing and subscribing and all those social media fun things. And thank you again, Nicole, for being with me.
Thank you.
All right, take care.
Take care.